another episode of Voices of Inclusive Research podcast. I'm your host, Dr. Ren, founder of Diverse Research Now. Today, we will hear the voice of Dr. Vivek Patel. He is Vice Chair of Academic Affairs, Professor of Clinical Ophthalmology, and Chief of Neuro-Ophthalmology and Adult Strabismus at the University of California, Irvine, Gavin Herbert Eye Institute. Dr. Patel is here to talk to us today about the prevalence and the latest research of thyroid eye disease, also known as TED. So let's jump right into this important conversation. How are you doing today, Dr. Patel?
I'm doing great, Dr. Ren. Thanks for having me.
Good. Thank you for coming. Can you share a little bit about yourself and how you got into what you do, the research you are doing in thyroid eye disease?
Sure. Well, thanks again for having me. This is an important topic. I guess I've been involved with thyroid eye disease as part of my clinical career for the last 20 years.
Okay.
I first went to medical school, then did residency in ophthalmology, so I learned about eye surgery, eye diseases. And thyroid eye disease is really quite prevalent in people who have problems with their eyes, especially double vision. Their eyes may be protruding. There's some characteristic findings. So we've been seeing this all along. And so I've got some experience over the years about this condition. And over the last few years, we've had really kind of breakthrough in terms of treatments. We've had lots more understanding about how to follow patients, how to treat them more effectively. So that's why right now is actually kind of an interesting and exciting time in thyroid eye disease. We have a lot more options to offer patients that have these problems. So it's a timely discussion.
Awesome. So tell us a little bit what thyroid eye disease is.
Well, it encompasses a kind of a group of conditions, or it could be due to a group of endocrinological problems or hormonal problems that begin in the thyroid, but it's an autoimmune condition in which that thyroid problem then causes problems around the eyes. It could be inside the eyes, it could be the eye muscles. The eyes may start to protrude. There's puffiness and swelling around the eyes. The eyelids tend to kind of retract a little bit. So there's a characteristic appearance in thyroid eye disease. But there's a lot of things that are happening on an autoimmune basis under the surface where inflammation and other scarring is taking place around the eyes. And it can be quite severe, affecting the function of people, not only how one looks and feels, but also how they see. It can even lead to blindness in some situations. It can be quite disfiguring. There can be double vision where you see two images. So there's a myriad of things that can happen.
Now, people that have this condition, are they being seen by a rheumatologist and someone like yourself?
They're more often seen by an endocrinologist.
Endocrinologist,
Right, because most of this is a thyroid abnormality. Most patients do have a hyperthyroidism where their thyroid's too active, but then there's others where their thyroid gland is actually quite normal or a little bit underactive, but most are hyperthyroid. And everyone who's hyperthyroid does not develop the eye disease part. But then there's some people that have the eye disease in which their thyroid is normal. So we work very closely with the endocrinologists because as the ophthalmologist, we're seeing something different. We're looking at a different part of the disease. So we have to work together. Among the ophthalmology community, there's specialists. There's people called oculoplastic surgeons who work on the eyelids and the eye socket. There's people like myself, neuro-ophthalmologists that are concerned with double vision, the optic nerve. So it ends up being quite involved, and you may have more than one specialist.
Wow. Where would a patient start in their journey? What are the symptoms, and how do they make it to you?
Sure, that's a good question. A lot of times it's fairly common symptoms like dry eyes or red eyes, or you feel like there's some swelling or puffiness around your eyelids. You might see your general eye doctor. It could be an optometrist, an ophthalmologist. Maybe they present to their family doctor because they're not sure, what's going on. Eventually, you make your way to somebody who takes care of eyes. And then if an ophthalmologist determines that this looks like potentially thyroid eye disease, he or she may then run some blood tests. That might be part of it. There's some autoimmune markers that are more commonly associated with this. They may even go so far as to getting a scan of the eyes, maybe a CT scan or MRI scan. And then if it looks the way that it might for thyroid eye disease, which are some characteristic findings, they'll make their way to a neuro-ophthalmology oculoplastic specialist. And you kind of work yourself up the direction of more specific management, and then we go from there.
So, Dr. Patel, can you tell us some risk factors for developing thyroid eye disease?
Well, we know it's an autoimmune condition, so those folks that have an autoimmune form of hyperthyroidism usually, so too active a thyroid gland, that autoimmune disease, it can create this problem around the eyes. But there are some issues that we can think of or some behaviors, like smoking, for example, increases the risk tremendously.
Now, smoking cigarettes?
Smoking cigarettes,
Or
any smoke,
any smoke.
even secondhand smoke, we feel
Okay.
can be related to an increase in the risk of developing the thyroid eye disease.
Okay.
So that's one modifiable risk factor that we have there. There's interest in looking at other possibilities as well, but the main thing I would say is smoking is something that you can do something about. There are patients that will have radioactive iodine treatment, to help keep their thyroid gland from being overactive, because people can generally have surgery to take out part of the thyroid gland to make it less active. They can take medications, or they can do radiation into their thyroid gland, and the endocrinologist makes that decision. But in some cases, the radioactive iodine can actually make the thyroid eye disease worse.
Wow.
So we have to keep all of those things in mind.
Okay.
But the smoking is an important thing. So the first thing we tell patients when they have hyperthyroidism or features of Graves' disease or may develop Graves' disease, or we think they might develop, is to just absolutely cut out smoking and exposure to smoke.
Okay. Wow.
Yeah.
Wow. Okay. And so we want to make sure that we share that we will have a link to studies in this area and TED studies. If you are interested in clinical trials in this area, you can find them in our show notes. Okay. So you had mentioned that there's new treatments in the last few years. Can you tell us about those treatments?
Sure. Well, for the longest time, it's pretty much steroids, basically prednisone or intravenous steroids, just to calm the inflammatory response, because inflammation is a really significant part of this.
Okay.
And so there can be a lot of active
inflammation. You have to manage the inflammation.
Correct. You have to manage that part first. So that's been pretty much the mainstay medically. And then after that, there would be surgeries. And these surgeries are quite effective. They've been, I think, nowhere close to perfected, but improved over time. And those surgeries could be to bring the eyes back into the socket, double vision surgery, eyelid surgery, and these are still necessary for many patients. But where we've really made advances is in kind of like the biological treatment of these, meaning that going beyond steroids to more specific treatments, research into those treatments where you can maybe affect the disease process at its core. And we understand a bit more about what's actually going on under the surface. And it's quite complicated, all the immunology and the biology behind what's going on. And we're really just scratching the surface, but the newer treatments are starting to modulate that aspect of the disease better than a blanket statement or blanket treatment like steroids.
Awesome.
You see. So whereas people may need steroids still, they may still need surgery, but we're able to affect the disease at a different level now.
Yeah.
And with the introduction of medications that are able to manage the disease a little bit better, it's spawned more research, and more companies are putting in lots of effort and time into coming up with strategies that are different from each other. So this is where I was saying that in the last few years, we've had real growth in our ability to manage this condition.
And the research of it. That's awesome. Yes, we know how important research is. That's how we find these answers to these questions, about different diseases. What groups are you seeing maybe in your practice or you just know about the field? What groups are you seeing that this might be more prevalent in?
What we know about thyroid disease, it affects everybody. It affects men, it affects women. It may be a higher incidence of women in middle age, maybe men toward the older spectrum, but it affects both men and women, probably a bit more commonly women than men.
Okay.
But everyone's potentially affected, okay? In terms of different ethnic groups and diversity of background, it can affect anybody as well. It can be people of all backgrounds. And most of the research we have is in patients with more white populations or Caucasian populations, just based on the way the research has been done. But we do know from different parts of the country and different parts of the world that this disease exists in all types of people. So we do really need to make sure that we understand that this is a disease that can affect anybody. But a lot of the information that we have is, in terms of clinical trials and so forth, is really more in predominantly in white populations. And that's something that, in my opinion, needs to be addressed at some point, just to have a much more realistic representation in our clinical trials and in our research about the spectrum of who is affected.
Exactly. That is exactly why we started Diverse Research now, to bring awareness to certain diseases where we are seeing a lack of diversity in these research. There's so many areas. TED is just one of them where we're seeing this lack of diversity. So, yes, it is super important for all groups to be involved in research so we can find the answers for all the groups. Because sometimes there's the medications. I mean, how do we know if those treatments you were talking about, are going to work for all the different groups if they were not involved in the research?
Correct. And there may be different ways and different groups respond to the medication.
Exactly.
There may be differences in the way there's adverse events or side effects or so forth. So unless you study the actual patient population that's out there, you may be missing something, in my opinion. So I think this is really important. And making sure that everybody of all walks of life in different regions of the country and so forth are aware that this research is being done.
Yeah.
And that's really important to improve recruitment as well.
Yep. Tell me about, what would you say to the community? If someone is out there in the community, they might be having problems with their eyes. What would be the first step they should take?
Sure. Well, of course, when you see an eye doctor, you have to give that doctor.
So go to the eye doctor.
I
That's
think
the
so.
first step.
Right. Well, if you're having problems with your vision or concerns about your vision, whether it's how your eyes look or feel, whether it's how you see in terms of double vision, not clear, first step is getting a little bit more clarity about that, right? And that individual is usually equipped to be able to differentiate what's happening, okay?
I have a question, though, because I see an eye doctor because I am pretty blind.
Okay, yeah.
I wear glasses. I have contacts in. So that's why I go to the eye doctor.
Yeah.
But if I didn't have problems with my eyes, I probably wouldn't go to an eye doctor.
Well, and if you didn't have glasses or need glasses, you saw clearly, you felt like your eyes are comfortable, you don't see any changes in your eyes, it probably isn't going to be thyroid eye disease or anything that's going on, right? Okay. We always encourage, though, that anybody at least over age 40, that's generally the recommendation, is seen by an eye doctor once a year. Okay, so they can even just pick things up because there's many diseases outside of thyroid eye disease that are kind of silent, subclinical, that you may not have. For example, glaucoma and other things like this could be present without you even knowing.
Even if you don't have vision problems?
Even if you don't have vision problems or realize that you have vision problems.
Okay.
So in general, I think it's a fair statement to say that being regular about these types of assessments is important. But beyond that, being armed with some of the clinical symptoms that can happen, like feeling dry eyes, although that's extremely common. A common reason for dry eyes is thyroid eye disease. Or if you see something different in the way you look, puffiness, the lid retraction. If you have thyroid disease in your family, that's another thing that could, make somebody think, and you have some of those symptoms, is that something that we need a little further evaluation?
If you have family history. And you said if you have dry eyes, how can you tell if it's like a normal thing or between there's a problem?
Right.
How?
Well, that's a good question. So if it's dry eyes, it could be just a common dry eye issue.
Yeah.
But your ophthalmologist should be equipped to basically tease that apart a little further. Although it is difficult sometimes to know why somebody has dry eyes, and that's one common symptom. If he or she sees other features like eyelid retraction or the eyes are a little bit more forward, or there's other features like double vision, it may make them a little bit more suspicious. But unless you go to somebody, you're not giving them the chance to work that up.
Yeah.
So I feel like from a consumer or patient perspective, be vigilant that if something doesn't feel right, go and see somebody. Let him or her use their expertise to decide whether something needs to be further investigated. And then from there, they can do so. Now, if you feel as though you've got some knowledge about it, you read about it, I think empowering ourselves with reading a bit. Internet can be dangerous, but if you do kind of take it within reason and just say, what are some things I could look for? We all educate ourselves with resources we have. There's nothing wrong with that.
Right.
But we just don't want to go too far in saying from the internet, but at least give us some background, right? And hopefully things like this can give people an idea of what to look for. So if you feel some foreign body sensation, you have double vision, you feel like your eyes are protruding or more puffy than usual, it's definitely worth a shot. Doesn't mean you have thyroid eye disease, but see somebody, right? And probably the eye care provider is the right person to see there, more so than your endocrinologist, more so than a family doctor, because that person is equipped to look at those things, has measuring devices, has ways to look at your eye in a more global context.
Right.
And they can do that. And then from there, knowing that this is a possibility, you can ask the doctor as a consumer, you can say, do you think I have any components or findings that could be suggestive of thyroid eye disease? And there's nothing wrong with that. It doesn't mean you have it, doesn't mean you're telling them you have it. But it is something that you can, at least bring it up. And that person could then be maybe a little bit more aware of, okay, let me look for features of that. And if there are systemic issues or family history of thyroid, to be aware and to let somebody know.
And so that's why I was going to ask, what is like the number one risk factor for thyroid disease?
There's no number one risk factor for that.
Okay.
No, I mean, autoimmune diseases they tend to grow in packs. So if sometimes If one has one autoimmune disease, they may have another. Doesn't mean you're going to have another, but you may. As I mentioned, family history is important in that context. But really, it's the clinical findings. It's the clinical features that are there. One can have it without their sister or brother or their uncle or aunt having it, you see. But these are all just clues in general for medicine. But I think just a regular evaluation is important so you can allow that person to use their expertise to see whether it needs to be moved up the chain. And so even if you're asymptomatic, like I said, the yearly exams is quite prudent because there's so many things that could be picked up well beyond TED. But if you have some of these symptoms, it's worthwhile getting a look.
Okay. What is the best way for the community to educate themselves? I know you mentioned the internet. I know we know the internet, yes, could be dangerous sometimes. But, I mean, it also is helpful. What would you say to someone in the community that needs to educate themselves on this?
Right. I think maybe internet is obviously a common resource. Most of us aren't going to the public library looking for thyroid eye disease pamphlets, right?
I mean,
maybe some people do.
I mean, is that is that a good resource? Like,
I don't think so. I think in order to stay current, the internet is probably a good source. There may be resources. There are resources like, Graves' disease foundations. Maybe even look at a thyroid eye disease foundation or thyroid eye disease network or a group that may have more information that's relevant. Even in our own field, in NANOS, which is the North American Neuro-Ophthalmology Society, there's information within our own website that has information about thyroid eye disease. There's a lot of resources that are out there. I think just perhaps being aware, we all have a sense of what could be a reasonable source versus not. If something that's endorsed by an American Academy of Ophthalmology or the American Thyroid Association, Graves' Disease Foundation, those are likely coming from authentic sources. But I think from there, you educate yourself, but then be open to discussion with your doctor or a health or an ophthalmologist or somebody that can help put that into context.
Don't just take it on yourself.
Correct. So you can be armed with some information and then you can contextualize that with a professional. Like if I learn something about real estate, I'm not going to go buy a house. I need to talk to a real estate professional because I don't know anything that's detailed about that. So I think that's the take home of that is give yourself information so you're prepared for conversation and then take it to somebody you trust.
Yeah. And there are different resources out on the web, as we mentioned. TEDcommunity.org is a resource for the community, probably where you can find a lot of information about the disease. And of course, again, like Dr. Patel said, talk to your doctor if there's any issue. And that actually goes across the board, right? Anything that's happening. I think I've said this on here before. We don't want people to just, have issues and kind of treat them at home. I don't even know how you would treat something like this at home. But
right. or we make assumptions it's this or that or the other. But you're right. Having information allows you to have a conversation.
Yeah.
But then let the professional help you navigate that.
Exactly. One of the things we do, we are out in the community often, educating the community about different diseases. We're so grateful for this podcast episode today to educate the community. And so, do you think that's a good strategy in educating more people? So what we're trying to get to, of course, as you know, more representative data, right? We have many populations that's underrepresented in this area, this health condition. We want to get more minorities, more Black and brown people into these studies so we can understand how it's affecting you. What more can we do? Do you think that's a good strategy? Just kind of having events, do things like this?
I think it's a great start for people to be aware that this condition exists and that there may be a name for what you're experiencing. Right. You may not even know that what you're experiencing is related to this.
You know what? I like that you said that because I do feel like sometimes we don't have a name for things. We just know like, okay, I have some issues with my eyes, or whatever. But yes, there are names to things and there's research being done in these areas that people don't realize. So that's why another reason why we like to bring awareness to these different conditions so people know like, hey, there's doctors and researchers that are looking into these conditions to get better treatments for the community.
It's sort of a disconnect sometimes. I have many patients who will say, well, I just was diagnosed with a thyroid problem. What does that have to do with my eyes? Because it's really, you wouldn't think of that connection. But there is a connection there. And it doesn't have to be that everybody with a thyroid problem develops an eye problem. But the more you're aware and the more we get that information out there, that these things, these organ systems are quite connected sometimes, That's the first thing, is the awareness. And then to know that something can be done. Because I think a lot of people feel like, well, what's the point of knowing about this or that? It's not your grandma's thyroid eye disease anymore. There are definitely things that look different today than before, and it doesn't have to go down the same path, you see? But as you mentioned before, all of this takes a concerted effort for us to know exactly how that research will affect you as a person and in general populations, because it doesn't mean that something comes out of a lab which looks perfect is going to work well for everybody.
Exactly.
So that's why these clinical trials exist, is to really vet in the best possible way we can how effective something is, how safe it is, how does it work in different populations, what dosing. There's a lot of things that go into it.
Yeah.
And we as patients also have to be part of that. It's not the doctors and the researchers that can dictate that. So that's why the clinical trials have to happen.
It has to be a group effort. I mean, that's what we do at Diverse Research. Now, we want to bridge this gap between researchers and the community, the people that the researchers need. We really put forth an effort to share with the community, like, hey, we want to serve you in this way. We want you to have this education, bring awareness to you. So like, hey, there's research being done in my health condition. Let me go see about if I can get into a study or if I am eligible for a study. Of course, I mean, no one ever knows if they're going to be completely eligible for a study until you come and get screened. But it's just being proactive, right? Being proactive about your health and addressing the things that concern you.
I think that one of the advantages, if we go down to the path where a diagnosis is made and then you'd qualify for clinical trials, obviously many steps down the road. But sometimes clinical trials scare people because we think of it like it's something experimental or something that could harm me. And of course, all of these things happen for a reason, because there can be all of those things that happen. But one of the things I would say to our clinical trials patients is that you are taken very good care of in a clinical trial, because the company, the physicians, everybody wants to know what's happening with you. So you're in a super monitored setting.
Yes.
So that's one thing that people who participate in clinical trials often feel, is that they were very well taken care of. Whether something works to the way that it was desired or not, there is a period of really intense monitoring, which should give somebody some security that they're not just being given something and then left to the wild.
Exactly. And that's key. I'm glad that you said that, because sometimes our community members think that research is being done and they're going to be given this as experimental drug, and then we're just going to watch to see what happens. No, we're going to, of course, watch to see what happens, but it's all about safety. It's all about safety. So if something is not safe for you in a clinical trial, you have to come off of that clinical trial. I mean, there's doctors that are watching to make sure that you are not being harmed.
Yes.
So
it takes months and sometimes years to design an effective clinical trial, because companies, physicians, everybody at stake needs to know whether something is going to work well. Ultimately, nobody wants to put something out there that's not going to be effective or harmful. And it really is a 360 kind of conversation. We need to hear what patients are experiencing, and we need to let people know what they may experience. But there's so many things that are discovered. But being a participant in a clinical trial, in a way, is being part of that discovery.
Yes, I love that, because we try to highlight that in the community. Like, yes, there's always going to be risks. We always we want to be very transparent with our community and tell them, like, there are benefits to being in clinical trials, but also there are risks. And so we can talk about those risks. But also something that's very rewarding is being a part of discovery, discovering things, that a medication that might work that could help your children. We kind of try to bring it home, and I feel like sometimes research, which is why we're trying to bridge the gap, research is sometimes so far away. It seems like, oh, that's in the world of science. I know nothing about science, but really it has to come together.
Yeah, it's a good point. You're actually much closer to it than you might think.
Right?
Yeah, because of course, maybe you are far away from the initial experiments in the lab and so forth. But by the time it gets to a clinical trial, the important steps of figuring out how it works in a human being are being conducted. But I think people may have the misconception at times to think that this came out of the petri dish and now it's going into your body. It's not what it is.
That's not what it is.
No.
There are steps to this.
Right,
there are
phases,
steps. And we talk about that all the time. We educate about that in our safe space meetings. we have a program called Safe Space where we bring participants in who want to learn more about research. And we kind of really break it down for them, like break down the whole process of research. And of course, what we talk about in that breakdown is the phases of research. And there's 4 of them. We've even had like trivia at some of our events where we, it's all about education for us, really educating the community, because we do feel like if we educate the community more about research, then they won't be so hesitant. If they can really get a good understanding, then they won't be so hesitant to get involved.
I agree. So, I think that skepticism is only natural when you're dealing with something new and unknown to you. But it's our job to kind of make sure that we are proactive about those discussions, be forthright from the physician standpoint about what we know that medication can do and what the possibilities are, and then for one to ask questions. Those questions should be answered. So if a patient comes and is going to be part of a clinical trial, asking questions is important so that you feel comfortable that what you're getting into is okay.
What can the researchers do? What do you think the researchers can do to get more people involved in studies?
So I think for one, to stay open-minded and to stay up to date. You mean clinician researchers, the ones that are getting people?
The ones that need the participants to come into,
Correct. And for us, it's to obviously know what's out there, stay up to date, right? Because in a burgeoning field like this, you want to be open-minded about everything that's coming out so that you can kind of have a broader view of things to see what could work for your patients. Right? And because the clinical trials are there because we don't have all the answers, but yet there's possibility of new things that we want to explore. And so, first of all, being aware of what's out there is important. And then having the time. We don't have a lot of time these days, right? As the patient or the doctor, whomever.
But
in these things where it still needs to be flushed out and vetted, we have to make time.
Yeah.
And that time is to answer questions, to see what we may think is relevant and so forth, and just being open to having those conversations with patients.
Yeah.
And then going from there. I think research, as we alluded to this earlier, we have to make sure that we have a representative population of people in our studies as much as we can.
That's right.
And that's partly on us as the researchers and the clinicians because of who we bring the study up to. It's also on the other side. Patients have to be willing.
Yeah.
So that's what I mean by being a 360 endeavor.
Yep.
But we have to kind of understand that if a disease affects all types of people, then we need to include all types of people in our studies to really make it indicative and representative. So those are all sort of onus from the side of who you're recruiting, who are you letting people know, and that education is important.
So important, so important. Well, thank you so much, Dr. Patel. Let me mention the resource, tedcommunity.org. Do you have any last words that you want to share? Any final thoughts before we get out of here?
I think it's been a good discussion. Thank you for having me. I think thyroid eye disease, you see a lot more of it now.
Okay.
I don't think the incidence has necessarily gone up, but awareness. We don't know what we don't know, right? So I feel like we see a lot more patients referred for thyroid eye disease because we've done a better job of getting it out there that there may be treatments. So I think knowledge, discussion, preparing yourself is really important, and then being prepared to have those questions. So empowering yourself with that information is really important. So we don't see things that we're not aware of.
Yes.
So I think that's the key. And that's true for physicians as well.
Yes. Empowerment. That's a key word for us. We want to empower the community to be proactive in their healthcare and consider research, consider clinical trials in your healthcare journey. So that's something that we definitely promote. So thank you so much.
Thank you. Thanks for having me.
We hope that we'll see you again. Maybe we'll come do a part 2.
Anytime. We can give you an update.
Okay, update on some of the treatments. Okay, all right.
Thank you.
Well, thank you so much.